Thank you, David, and good afternoon, everyone. I just want to make a few additional comments before I turn it over to our guest. David reinforced the importance of us really adhering to the preventive measures that we've highlighted over and over again. We've come quite a long way over 6 months, but as was anticipated, we are seeing an increase in the number of cases that we are associating with the Labor Day weekend. And it's going to be critical that we strive to contain increased transmission at this point. So those preventive measures that David outlined are really critical, but there are also containment measures that David mentioned briefly. And I want to highlight those specifically today because those are really critical at this point in this juncture in time. It's important that anyone who is aware, so that's a healthcare provider, a laboratory, or an organization, that someone in their organization or a patient of theirs or someone whose lab was run in that particular laboratory, if there's a positive test, that needs to be reported to the health department. That's written in the health directive, but one of the reasons for reporting is so that we can quickly implement isolation measures, begin the contact tracing, and then implement quarantine measures. That way, if we do have transmission, we're able to limit the exponential growth of COVID over time. So really staying on top of that is going to be important. It has been all along, but it's really important at this time so that we continue to move forward. I also want to highlight briefly our decision making and announcements that we may or may not make. I think everyone's aware that I look at things from the incubation periods, and specifically relative to Labor Day, we said we would need to wait at least 14 days to look at any increase in cases relative to Labor Day. But we also know that for individuals who might require hospitalization, that may be another 5 days or so beyond that 14-day period before we see the impact on hospital systems. So we are really looking at the data. Today was pivotal because we had almost 300 new cases. Clearly the data tomorrow and through the weekend is going to be significant. So we don't anticipate making any formal announcements regarding the health directive until at least Monday, so that we can make sure that we're data driven at the local level. And lastly, I just want to reinforce that we do have plenty of testing capacity in our community, and the more people that get tested, the more we can identify those individuals who are active cases, and and particularly those who may be asymptomatic.